it is already fully equipped and everything is prepared. You can see that every aspect that the doctor will need, engineer or even nurse, is already in its place and it's clear, smooth, and everything. What? No, this is not in Egypt. Yeah, but I can give you some real-world photos afterward. So, first of all, as I've told you, smooth workflow equals safe patient outcomes. So, good preparations means smooth workflow, safe outcomes, and efficient teamwork. In order to minimize delays and complications, you also need to be prepared. Yeah, thank you. This one. Yeah, it's a pointer. Thank you. But it's not working as a slide. Sure. Okay. So then we will, when we minimize the delays and complications, also this is a very good matter, and it's very important to make sure that your EP is very prepared. So, from my point of view, there is a pre-case checklist. First of all, you need to know that your patient is prepared, whether the consent, the labs, the anticoagulation checks, all the patient-related things. Then we go for the equipment check. So patient preparation is for the nurses. Equipment check is also for for the engineers. So they do the equipment checks. We make sure that the catheters doesn't have any defects. Also the sheaths, all the ablation systems and stimulator recording system, everything is working and in its own place. Then we go for the imaging and mapping systems. We also make sure that the CAR2 is working inside and the connections are in its place, or any equivalent device. Then there's the emergency backup defibrillator and the crash cart, the pacing, everything. We need to make sure that everything is ready and it's in its place. So this is a pre-case checklist from my point of view. Then we go for the lab setup and sterility. As you can see, this is not from Egypt also, for the people asking, but yeah. But as you can see, it's very sterile and prepared. There's lead aprons, there is everything that anyone needs. EP recording system is already on and working. The stimulator is already set up. Ablation generator and irrigation systems are in its place. Proper cable management and electrode labeling is already on. So you need to make sure that you are ready for the case 100%. So then we go for the roles and team coordination. This is a very important thing because we've learned in Egypt on the hands of Dr. Mervat that the teamwork is the most important thing, and the coordination between the team is essential for making every procedure good, making every procedure counts for the patient, and that the patient will get the best results. So we first clear the role allocation for physicians, nurses, allied professionals, technicians. We confirm the patient ID and case type. Then we go for the safety timeout before procedure start. This is the key for an organized team. So before we begin, we need to troubleshoot everything before this starts, so we do not meet anything that might happen occasionally or something. So we do the power on self tests for all the equipments. Then we verify that the signals and the qualities of the signal and filters on the recording system is all good and set. Then we go for the mapping system. We do the calibrations if there is a patches, if we want to connect the patient or something. This is very important also. Then we go for the backup catheters and cables and make sure that we have the backup. If there's anything phased us throughout the case, we'll be ready. So the key first, preparation equal prevention. If you are very prepared and good prepared for the case, you would prevent any occasional things that might happen bad throughout the case. So then you use a structured checklist. This is a good thing to do. Make a checklist for yourself before you enter before they enter the EP lab. Always verify the equipment, the patient, and team readiness. Also, effective preparing save time, reduces stress, and improves outcomes. So thank you very much. This was my take to how to prepare your EP lab. Thank you. Any questions? Next speaker would be Ahmed from Microport.
I have some questions.
Yeah, please, go on. Yeah.
Thank you. This is Bienvenue from Rwanda.
How are you?
In your experience in Egypt, in the centers where you may have one cath lab serving both intervention and EP, how would you optimize the preparations? Do you schedule them on different days? Could you prepare like morning cases for EP and evening for intervention? So give us your insight. Thank you.
This is a very important question, and Dr. Alfie is the team leader in Egypt for my group, and he is going to tell you how to make use of the same lab. This is the same story in Egypt and maybe in North Africa. How to use the same lab, how to get your schedule, and how not to waste time. Alfie.
Yeah, thank you for your question. It's a very important question, very, very important question, especially in Africa. Most of the hospitals have maybe one cath lab or two cath lab by the most. In Egypt, we have the experience of one cath lab doing EP, and we organize to do the EP work in one day, only one day, because some hospitals, they are saying that EP is not worthy to do. EP takes a lot of time. EP destroy the cath lab machine. So we take only one day, which is Tuesday. And actually, we try to be very, very fast in entering the patient and preparing the next patient while the previous patient he is in the waiting time. You have to prepare all the equipments like Youssef has said. You have to be aligned with the hospital management, because if a STEMI case you know about it while you are just entering the EP procedure, but you have started, so you have to be very fast and you have to be very efficient with your patient. So it's a multimodality thing that you have to work very fast, be very efficient, and to be aligned with the management and the cath lab nurses and other interventional doctors. But the most important thing, to be very fast dealing with the list, because we have a list of 10 patients maybe, like 7 ablations, 3 pacemakers. Sometimes we put IV devices in the same day of the list. So the rapidness of the list is the key, and you have to be aligned with the management of the hospital, because the STEMI patient is more important than doing an elective EP procedure. Thank you.
Thank you, Dr. Alfie. Next speaker, Ahmed from Microport. So how to prepare for CG. Ahmed from Microport.
So our next speaker is engineer Dr. Muhammad Ahmed from Microport, and he will be discussing with us on the topic of how to support in 3D mapping procedures. Please.
Just a second.
من فوق. Microport is a Chinese company which is booming in the market of electrophysiology. They have everything, and at 3 o'clock we'll show you all their innovations and equipments. And I visited them, and I was fascinated by what they reached in very short time. Ahmed will talk to us about 3D mapping. We have many machines in Egypt. I have one. I work with it in private practice. It's all in one. It's a EP system, which is very clear signal, very easy, friendly, and also it has a 3D capability, which can move from one hospital to another hospital. And I think it is going to be the solution for Africa. Ahmed, your presentation will, okay? Upstairs? You bring your own computer, better. Yeah. Please, for every speaker in this session, prepare your laptop in order to connect it to the presentation directly, which will save a lot of time. Any questions about the lag in the cath lab? About
Dr. Mervat, actually, to make it interactive, I was curious how many of the attendees is working in a facility that have a 3D mapping machine?
How about start by EP? Convention. Make it simple. I am African. Bradley. Where are you from? Are you Josephine? Hello, Josephine. So you have an EP system, conventional EP system?
We have the old machine, so we are going to upgrade in a few years to come.